Thank you, Naomi, and good morning. I'll take you through some of the numbers and geographic location of the cases in today's numbers. So again, we're seeing high rates in the northern suburbs. Yesterday, 681 new cases, making up 39% of the total. This included 309 in Hume, 180 in Whittlesea, 90 in Moreland, and 50 in Darebin. 29% of the new cases were in our western suburbs, or 514 cases, across all different local government areas, but 111 in Wyndham, 105 in Melton, 103 in Brimbank. Concerningly, this rate has doubled over the past 7 days. 57 in Moonee Valley, 48 in Maribyrnong, and 35 in Hobsons Bay. Cases are continuing to grow in the southeastern suburbs, making up 21% of today, or 370 new cases, including 131 in Casey, and this rate has tripled and is showing the largest growth in Melbourne. As we've said before, COVID is around everywhere in metropolitan Melbourne. Please do act as if it's, at the supermarket. When you go, keep your mask on and practice your COVID-safe behaviours. 63 in Greater Dandenong, 37 in Cardinia, 22 in Monash, 27 in Port Phillip, and 108 new cases in the eastern suburbs, including 26 in Knox and 25 in Manningham. Cases are also growing as a total proportion. We've got in regional Victoria. 86 new cases in regional Victoria yesterday, and there are 555 active cases outside metropolitan Melbourne. Some of the larger outbreaks are in Greater Geelong, with 16 new cases yesterday, total of 61 active cases. 15 new cases in Mitchell Shire, where there is a total of 120 active cases. 14 in Shepparton, total of 67 active cases, and 9 new cases in Latrobe, again a total of 67 active cases. As the Premier said, we do have a greater understanding of the outbreak in Latrobe, and pleasingly, due to the lockdown enacted a week ago, cases have not taken off at a great rate. The cases we've seen are primarily linked. The few cases that are unlinked, we believe will be linked or in similar communities to previous cases, which is why we're going to be able to lift the lockdown at midnight tonight. It's also partially due to the great response to vaccination in Latrobe. It's grown 6 percentage points to 79.3% coverage over the past week. So while people have been leaving their home for that fifth reason to get vaccinated, and we thank the residents of Latrobe for doing so, that 6 percentage points is above the state average growth over the past week, and those increased vaccination rates, as well as the increased doses being able to be delivered to our sites in Latrobe and Gippsland more broadly, are again one of the reasons we feel more confident to be able to lift the lockdown. With respect to contact tracing processes, we've had some initial feedback from the supermarket industry on our revised protocols that were implemented on Saturday, which take into account greater rates of vaccination and, balance the risk of being able to deliver food security to Victoria against the risk of transmission in those environments. We'll continue to work with the supermarket industry this week, but initial feedback is positive. We'll get more feedback from them this week. We'll look at how it's been operationalised, both for our contact tracing teams, our local public health units, and the supermarket industry themselves. And we do hope to be able to roll out those revised protocols in other critical industries to help keep Victoria moving and safe. We're also taking into account a lot of the feedback we've received from GPs, working very closely with the Royal Australian College of GPs, and taking into account the Tier 3 PPE in those environments and looking at enacting similar settings to our health services, whereby we might have reduced rates of furlough or For moderate risk people who are fully vaccinated, who've been exposed to COVID, we'll look at a 5-day furlough period and then increased rates of surveillance testing in order to ensure that we don't miss any transmission. We're working on that for introduction in coming days, and we should be able to help further protect our health system and ensure that people are able to access their GPs for any health concerns. As the Premier mentioned, we often talk numbers at this stage and in front of these cameras, but they're not just numbers, they are Victorians. And I'm really pleased to be able to introduce Will and Kim today to put a face to those Victorians who have suffered COVID and to share some of their experiences. So Will, thank you very much.